Yay! Welcome back to our podcast, Functional Medicine for Moms. I'm Kelly Moline. I'm a licensed pharmacist, functional medicine consultant, and I'm a wife and new mom.
And I am Landon Moline, Kelly's husband, and father of little baby Danielle.
Yay.
Yay.
Okay, I'm gonna pick it up. But so last episode we talked about starting solids with our baby, and she is 7 months old now. We're getting her listening to her signs of readiness. There's a lot of conflicting data and people telling us when babies are ready to eat. So we are really in that world of solids. And so part of the starting solids is like spacing out the allergens, and everyone go by their pediatrician. My pediatrician told us to space out allergens every 3 days so you can catch if something happens. So I wanted to go deeper into food sensitivities and allergies because they are different and you're going to be looking for different things. And I'm researching this as a new mom for my baby, but it also applies with like adults and my practice as a functional medicine consultant. And so I'm seeing this as adults when I do food sensitivity testing too. So there are some similarities. So wanted to dig deeper into it.
Okay, and define allergens just for those of us that, may not live in that world every day.
So like what to look for, or
no, what allergens are, because you said I'm introducing allergens. So are they just foods that would cause allergic reactions, or is there a bigger definition?
So yeah, they're foods that have higher risk of allergic reactions. So foods that are just going to be more likely, or more people have allergies to these certain foods, which you can have allergen or sensitivity to more foods than that. But allergens are going to be like your peanuts, your wheat, eggs, dairy, shellfish, tree nuts. Like there's a whole list of allergens that are going to be more likely to cause those severe allergies.
Okay, great. Just wanted to make sure I knew exactly what we were talking about.
Yeah. And I talked that I have the Solid Starts app. And so when you have that app and you're like researching each food on how to introduce it to your baby, it'll say, is this an allergen? And it'll say yes. And you could probably Google it too. So we're like going through the allergens every 3 days, pretty much.
Kind of like when you look up for a dog, like, can dogs have this?
Yep, but for a baby.
Not to compare the baby to a dog, but.
Yeah, so, yeah. And like how to introduce it to a baby so that they can eat it better without like risk of choking, or reduce the risk of choking, all of that too. But yeah, so those are allergens, and I wasn't really that nervous with them until my friend, who I've talked about before on the podcast, how she has a baby a few weeks older than Danielle, and he reacted immediately to eggs. And so she texted me that he was throwing up right afterwards, and so that made her really nervous. And so then they went to get further allergen testing at an allergy clinic, and then like they do like skin pricks and put the allergen in each prick. And then he also tested positive for peanuts, so then she had to get an EpiPen and all these things in case the worst happened.
Yeah, that's scary. But
it is.
I don't know what we would do if our kid was allergic to peanuts.
Well, yeah,
we love
hard.
Peanut butter,
so
and everything peanuts.
And I think that's like the big one that parents seem to be most concerned about. Like, have you seen those videos where parents are giving their baby peanuts for the first time, and they're like right outside of their emergency room? Have you seen those?
No.
They're like, just in case, they can like go right in there. So that's also something that I wanted to talk about, because I think people expect to have a reaction right away, like my friend with her baby and the eggs, and he just like immediately threw it up. But that's not always the case too, because your body, or the baby's body, is going to see it, and then it's going to be like, is this friend or foe? Is this safe or is this dangerous? And so it's going to build up. So if it thinks it's dangerous, it's going to say, okay, I don't think I really like that, so I'm going to create antibodies for it, which attack that food particle. And then next time we get it, we're going to have our entire immune system react. And so each time you introduce it, it could have a bigger reaction. So a lot of the time, like with peanuts, they may not have a reaction the first time, but they might have a reaction the third time because it's building up. Does that make sense?
Yeah, that's kind of crazy. I wouldn't have thought of that because if they don't react the first time, then you're like, we're good.
Yeah.
I'm sure it happens all the time where someone's like, no, we've already given them peanuts or whatever.
Yeah.
And so they think they're safe. And then, the third time, fourth time, all of a sudden they get this huge allergic reaction that they're not ready for or expecting.
And they may be introducing like more things at a time. Let's say you do peanuts and you're like, we're good. And then the next day you're doing dairy and peanuts and they react and you're like, wait, was that the dairy or the peanuts? Because this is the second time you're introducing peanuts, but maybe the first time you're doing dairy. So that's another reason why you want to space it out more. Yeah.
So, at what point are you in the clear? The third, fourth? How many times would you say? And I'm assuming that there's more risk like early on, like in the first few times than like the fifth, sixth, seventh, eighth, whatever.
Yeah, I think you're going to catch something happening in the first few times. But they say to space it out every 3 days. And within those 3 days, I continue to introduce it.
Like spacing out, like when you give them, say, we're using peanuts for this example, but like peanuts every 3 days or any allergen every 3 days?
So a new allergen every 3 days.
Gotcha. But if you're just testing, if they didn't react the first time, should you test peanuts again 3 days later and kind of do it over the course of a week?
So what I'm saying is like peanuts, you may introduce day 1 and then you're also introducing it day 2 and maybe a little bit more. And then you might introduce it maybe twice that day or still once, and then day 3 you're introducing it again. By that time, you're going to catch if it's an allergy, like a true allergy.
Okay.
And then the 4th day, you can introduce a new allergen.
Okay.
But still including like peanuts in the realm. So yeah, you want to continue exposing them to that.
Got it.
So what to expect. So I didn't really know this. The true allergy, let me back up. True allergies and food sensitivities, and they're different. And so I want to explain that. So a true allergy, if we're getting into microbiology, and this is like our true functional medicine type episode where we're digging more into the science, but true allergies are an IgE reaction. So that's a type of antibody in your body. And then food sensitivities could be like an IgG reaction. Okay, so it's a different type of antibody, and food sensitivities may not happen directly afterwards where allergies typically do. So allergies is what you think of with like your throat closing up, you're wheezing, you're throwing up, hard to breathe, maybe like swelling in the face, the tongue, that kind of thing. And so that would be your allergy, and that's going to happen a lot quicker with that IgE reaction. So you're thinking like a couple minutes after or immediately after, within like 2 hours afterwards. So the first time I introduced an allergen, I started with egg yolk because I've heard that egg whites have more allergen potential than egg yolk. So I started a little bit simpler, and I did it like before her dinner. Like we did the food, cleaned her up, and then we went to bed because that just made sense with our schedule. And then I'm putting her to bed. I'm like, oh no, if I put her to bed and it's still within that 2 hour window, like I'm not going to catch if something happens, and I don't want her not to be able to breathe when I'm putting her to bed, or like I put her down and she can't breathe. Obviously I'm monitoring her on the monitor as well, but it's hard to see everything sometimes. So that's when I learned or thought of like, next time I do this, I'm going to do it either in the morning or like early afternoon so I can still monitor her throughout the day rather than just put her to bed,
Yeah, but they can have reactions though up to 24, 48 hours, right?
So the true allergy is going to be likely more close, so within the 2 hours. But a food sensitivity can happen 72 hours after. So that's why we're also spacing it out by 3 days.
Okay. So just to recap what you said there, that why reactions happen, allergic or sensitivity reaction is antibodies are being created to fight whatever food is in the system that the body is like, no, we're not sure about this. But they create different types of antibodies. And that's where like one has more of a reaction than the other.
Yes, that's how it's happening, but why it's happening is a little bit different too. So we talked in a previous episode about leaky gut, and the gut lining may have holes in it. And so food particles can go through it to the bloodstream, and then the immune system can be like, this is foreign and I don't know what this is, so I'm going to attack it. So babies naturally have a leaky gut or a permeable gut, so things can go through it easily. But that can have a higher risk of food reactions during that time. So there are things you can do to help prevent food reactions.
By building up baby's gut health from a young age.
Like focusing on their gut health. Yes.
Okay, so the stronger gut you have, the less likeliness you have of having a food sensitivity or allergic reaction.
Yes. Yep. And that's how it goes with adults too.
I was going to say, because we talk about gut health in adults all the time too.
Yep. So when I do like food sensitivity testing in adults, a lot of times it correlates with a leaky gut. So when we're fixing their leaky gut through supplements, diet, lifestyle, all of that, then like we do another food sensitivity test and it looks vastly different.
Gotcha.
Yeah.
Interesting. Okay.
So I talked kind of about what to look for food allergies. So food sensitivities, that might look a little bit different. And so that could look like eczema, that could look like fussiness, not being able to sleep as well. It could look like reflux, gas or bloating, ear infections. So there are a lot of things that you may not correlate with like the food they're eating, you know?
Yeah.
Because I know a lot of babies or a lot of parents that complain about like eczema. And I think so many babies now have eczema.
I was going to say, like, so many babies have eczema. So how do you tell the difference?
So it could be from a food reaction. And so I don't think a lot of people think of that immediately. And it could be from other things. It could be from detergent, chemicals, you know, what they're bathing in, all of that too. But part of it could also be the food they're eating, or just focusing on like that gut health could help lessen the severity of eczema or get rid of it.
Got it. So then if they're reacting to these food sensitivities and allergic reactions, do you just avoid those foods then, since they already have them for like until they grow up, until college or whatever? Yeah.
So true allergens, you probably will avoid, like peanuts or whatever. And it probably depends on the severity of the allergen and what the doctor wants you to do, because there are like small inoculation where you're giving like little tiny doses to help buffer the immune system, and then they can eventually tolerate that. I know that's a thing as well, but I'm going to let the allergists
microdosing allergens, so your body like learns to not fight them.
Yeah, pretty much. Yeah. And I'll let the allergists cover that and fix that. But typically like true allergies you're going to avoid, but food sensitivities you're going to like take out for a while. Let the gut heal itself, focus on other things, and then you can reintroduce it and then monitor from there to see if it's still a sensitivity. A lot of kids grow out of sensitivities, and then adults too. Like I said, how if we're doing a food sensitivity test and then we focus on gut health and then we reintroduce the foods, they may not react the same, and then we could do the same food sensitivity test and they don't have those same sensitivities.
Yeah, because when you rebuild the gut lining, less things are getting through that lining, less foods are getting through it, and so that it's not having those reactions. So that makes sense. I mean, if you strengthen the gut lining, that you would have less reactions in the future.
Yep. So what do we do to help prevent the food allergens for our baby? I think that's like, is there anything we can do? I think that's a good question. So I wanted to dig into that, because that's things I'm looking at too, especially when my friend messaged me and she's like, is this it? Can he never have it anymore? So the baby's gut is immature, it's permeable, or is leaky gut, but there are things you can do like breastfeeding, and she's breastfeeding and stuff too. But breastfeeding really helps because your breast milk is filled with IgA, antibodies, so a different type of antibody as well. So it's going to help the immune system or help like mediate the immune system during that time. So that's really important. And then it's going to help, the breast milk can also help the gut bacteria. So having a lot of good bacteria and then preventing like the bad bacteria from overgrowing, because when we're talking about gut health, we're also talking about like the good bacteria versus bad bacteria along with leaky gut. Okay. So breast milk, if you're able to breastfeed or if you have pumped breast milk or donor milk, that's going to be one of the key factors. But also if you're formula feeding, having like a clean formula, making sure they're not sensitive to the ingredients in that formula. I know there's a lot of different options from like cow's milk, goat's milk, like different things like that, and organic and stuff like that. So if you're able to find a good formula that works with your baby, and sometimes a lot of moms try different formulas to see what works best, and then doing other things. So like reducing stress in the home, because that's going to influence how the baby's reacting as well. And then like reducing the chemicals. So like laundry detergent is a big one, candles, fragrances in general, reducing the chemicals. And then
Do those chemicals hurt gut lining or?
yeah, so
Okay.
because the body's responding and it's like creating more stress on the body.
Yeah, because it's fighting other things, and so
Yeah.
it pays less attention to fighting the sensitivities.
Yeah.
Gotcha. Okay.
Kinda.
So like, is
Or-
there?
I don't know if you got that. It's less concerned about like healing the gut and it's more trying to fight other things. Is that what you meant?
Pretty much.
Okay.
Yeah. So I mean, if you are not paying attention to, because food sensitivities, there can be different severities, right? So if something's not as severe of a symptom, say eczema, which is pretty common in a lot of babies, that's actually like a food sensitivity. If you leave it unchecked and you just keep on giving your baby that food that they're sensitive to, are they more susceptible to getting even more food sensitivities and like it compounding?
Probably.
Just because they're already like, it's already reacting to one thing, and then like you just keep adding more, it's kind of piling on and snowballing.
I think it's going to snowball possibly with other food sensitivities, but also with like other things going on, like the immune system, because your immune system is trying to fight off all these foods, which it doesn't need to, and it may not have the resources then to fight out like an illness. Does that make sense?
Yeah. I mean, that's kind of where I was going with it a little bit too. So I'm like, okay, well then all of a sudden, does it jeopardize your immune system, which can then lead to other issues? Got it.
So yeah, the promoting gut health is a big one. And so having like, especially if the mom's breastfeeding, but even not, I think promoting her gut health can help the baby as well.
Okay. Are there other things you can do besides breastfeeding or keeping their diet clean that would help the gut health of a baby?
So probiotics can be good. So if you're breastfeeding or not breastfeeding, formula. So I would say, especially with formula fed babies, giving them some sort of infant probiotics would be really helpful. So probiotics are just replenishing the good bacteria in the gut. And there are more and more studies going out saying that gut health is like so important, but especially like infant gut health and how that's going to set them up for life. So my practice, we're talking a lot about adult gut health, and then having a baby, I'm like, is this important for babies too? Drastically important. So it's like setting them up for life with their immune system, their sensitivities, how it could influence obesity rates, a lot of chronic diseases, even cancers. So it really matters.
Wow. Yeah. It sounds like it's never too early to start worrying about gut health.
Yeah. And I believe it even starts in pregnancy.
Yeah. I mean, that makes sense.
Because I see a lot of people for like pre-pregnancy planning. And so we're like doing gut testing, doing cortisol testing, possibly even doing detox before they want to conceive, because that's going to influence obviously their health of being able to carry this baby. But then the mom's gut health goes to the baby's gut health. So
I've heard that.
Yeah. So
Yep.
especially in like a vaginal birth is where that is being delivered to the baby.
The microbiome.
Yeah, you got it.
Got
So
it.
it's being delivered to the baby, where a C-section that is kind of skipped because they're not going through that vaginal canal and getting all of that good microbiome. So that's also when you might want to do probiotics and other things as well to replenish what should be there to set them up for life.
Got it. Wow.
And this is why I was a little upset when we ended up in the NICU and she was on so many antibiotics from the start. And that's when I started doing probiotics.
You're like, no, Danielle's gut health.
Yeah. Because I was on probiotics during my pregnancy. I was actually on 3 different types of probiotics doing different things. And yeah. And then I like was able to have the vaginal birth, but like, yeah, she was on antibiotics right away. And so it wiped out everything. So
I had no idea you were worried about baby's gut health when
Really?
you were pregnant. Nope. I knew you were taking a bunch of stuff, like prenatals and
Yeah.
all that kind of stuff, but I didn't know what they were
I probably
for.
don't
So
tell you all that.
I'm learning this stuff today too, folks.
Yeah. So that's important to set them up. And so
Yeah, sounds like it.
even when people come to the pharmacy for antibiotics, the antibiotics are going to wipe out the bad bacteria to cause the infection, but they're also going to wipe out the good bacteria. And so she didn't end up having an infection in the hospital. They were putting it on prophylactically just in case there was an infection while they're doing all the testing. They were worried about like sepsis, meningitis, some serious infections. So I get it. If I were to do it again, I would make the exact same decisions. It was just kind of a downer at the time.
Yeah. I mean, that's especially when you're going through birth, things are just unpredictable. You can't control everything. And so you just do the best you can.
Yep. And then I'm really glad that there are things that we can do to help like replenish afterwards, like infant probiotics and that kind of stuff too.
Are there certain probiotics that you recommend specifically for babies?
Like strains. I'm sure there are strains. I don't know that specifically. I know there's like a lot of bifidobacterium strains, but
Are you saying strains is like a certain type
of
probiotic?
bacteria.
Okay.
Yeah.
Okay.
Was that your question?
Yeah, like I mean, saying because you said probiotics help besides breast milk. I don't know if there's other ways, but is there a certain type of probiotic? Because I feel like that's a general thing is probiotics.
Sure.
You can go buy a probiotic, but like, is there a certain type that's really proven to be good for babies, infants?
Yeah, there are infant probiotics. I would say brand and quality definitely matter. And so like I've used the Designs for Health brand and I really liked that. They come in little sticks. And that has like a good quantity and diversity and digestive enzymes as well in it, which is why I like
Little
it.
sticks.
Little like powder packets that you can just dump into a bottle. What I don't like about it is that if you're exclusively breastfeeding and not doing bottles, it's pretty hard to do.
You're not just giving the baby a horse pill?
No.
Oh, okay.
But yeah, you want to make sure that the bacteria, the probiotics that you're giving anyone, they're still alive when they hit your gut. Because a lot of companies don't do that testing, so they could be giving a probiotic and then they're either dead right to start with, or they don't pass the like stomach acid part and they die there before ever getting to the gut.
The probiotics dead?
Yeah.
Yeah, okay.
So you want to make sure they're alive and well to actually do their job.
How do you know that? You just buy the brand?
The quality.
Yeah. Okay.
Yeah. Dig a little deeper into quality of probiotics. And if they do testing with that, that's really important.
Okay.
Yeah. I mean, I have my thoughts about certain brands, more like pharmaceutical grade or medical grade brands are going to be better than maybe just like getting it off the shelf at Target or Walmart or CVS, right? It just really depends on the brand. So sometimes even the cheaper ones, it's a waste of money if it's not working. So,
yeah.
Okay. So we kind of got off of what my outline was going to be. So let me look into
Whoops.
which was good because you were asking good questions at the time. And so I just wanted to roll with it, but I want to make sure I didn't like miss anything. Yeah, I think you asked like, is this forever? So we talked about that. Oh, and then other things that I thought was cool. So things like being outdoors, pets can help reduce risk of allergies in the future. I thought that was cool. We have 2 dogs.
Is that specifically like allergies to other pets?
No,
or
like
all allergens?
I think all allergies.
Oh.
Because I think that like allergies to foods, your body's even reacting kind of similarly to allergies to pets or like grass or outside pollen. Allergies are allergies, whether it's one thing or another. It's creating that IgE or IgG or whatever that is. So in the body.
Gotcha. So pets help.
Pets can help
with allergens or reactions,
and
sensitivities.
Like being around dirt and all of the like mother nature, right, is all helping, because I think it's just like exposing them to more. So being in a completely sterile environment may not be helpful, even though we want to put our baby in a bubble sometimes, because they're like having those like minor exposures to help build the immune system tolerance.
Yeah, that makes sense. If you isolate someone from everything for a long period of time and then expose them to everything, their immune system is shot. It hasn't had a chance to build up, and then they're going to have reactions to those things. So that makes sense to like expose them to more things at a younger age. Maybe not all at once, but like kind of
And that makes sense too with like what happened in 2020, right? And having everyone indoors and locked up and just being fearful of everything that they come in contact with. And then we get back into the world and then they get sick and they're like, see, this is why. I'm like, well, you've been locked up for 2 years. That's not exactly helpful.
Locked up, wearing masks.
Stressed.
Like, when you're not going out, your immune system's lower. Then all of a sudden you go out into the world and start life again. And
Vitamin D, sunshine, like all of that is really helpful for the immune system.
Yeah, I was going to say like the sun was a big one too, because people weren't really going outside. And so, they when they finally got to go back out into the world, like vitamin D helps a lot as well. So
so I think we got a little off topic there,
again.
but so food sensitivities. Okay, so how can we support it long term as well? So I talked a little bit about antibiotic use. So especially for like viral infections like cold, flu, a lot of different viral things, you don't want to use antibiotics, and you can use this with the discretion of your pediatrician, but every little sniffle or little, earache, you don't want to just give antibiotics, because that's going to wipe out their gut health. So the more that we can help support their immune system or just help get over that hump when they have a little sniffle, that's normal. And then you can use probiotics, breast milk, like all those things, healthy whole foods. We also started with like meat stock, and we talked about gut friendly solids, all of that. But so that's a big one. And then when they do have food, that food diversity as well. So just having a lot of different whole foods is going to be really helpful too.
Yeah, I think whole foods, we've talked about kind of before, and it helps with their regular nutrition. And if their nutrition leads to better gut health, better immune system, then obviously I think that'll be easier to fight off different reactions, food sensitivities.
Yeah, so we talked a lot about the baby food allergies and food sensitivities, but can you see how we can like draw the line to adults as well? It's pretty similar.
Well, yeah, I mean, for one, it sounds like it starts from a young age. If you start your kid off with a healthy gut, you're probably gonna have less problems in the future. And like, there are certain food sensitivities you could be dealing with as an adult, whereas if you had better gut health as a kid, maybe you wouldn't have those issues, those food sensitivities. Not to blame your parents for all your food sensitivities, but it sounds like you've got a better chance at not having those if you start early.
Yeah.
But you still can be treated for better gut health and heal your gut lining and all that kind of stuff as an adult as well. Because I mean, the human body is still the human body, even when it's older. So
Yep, it's pretty amazing. But even if you're doing everything perfectly and you're like check, but I still have a food allergy, it still can happen. It doesn't mean that you're a bad parent or anything like that. We're just trying to talk about like what we can do to reduce the risk or severity or how to help it over time.
Yeah, I'm always all about control what you can control. And you can do your best to be the healthiest person out there, but even healthy people get sick, and that's totally fine. That's your body's reaction to find those things, and that's how it gets stronger. And so you shouldn't beat yourself up if you have a food reaction. Like that's just, it's a natural part of life.
Yep. Okay. That, I think, answered all of our questions that we thought of for food sensitivities and allergies and how they differ and what to do about them.
Nice.
So
Learned a lot.
next episode will kind of be our crunchy mom lifestyle type of episode as well. And so giving more like life updates. We don't do that as much in these like functional medicine deep dives, but yeah, if you have more questions on or topics about what you'd like to learn about functional medicine, or like what's our take on that versus the more conventional world, we're happy to add it to the list.
Or if you have questions about even food sensitivities or allergens, and how to handle that with your newborn or anything like that that has to revolve around our discussion today, you can also comment on our YouTube channel or even send in questions or comments on your Instagram.
Yep.
Which is, do you have a new handle on that now?
It's just functional medicine for moms.
There you go.
So to be the same, I was like, should I do functional medicine mom? No, I'm like, let's just keep it all the same. Functional medicine for moms.
Yes.
But
like
my
that.
email is kelly@moline-method, but that'll be in the show. Yeah, kelly@moline-method.com. That'll be in the show notes too.
Got it.
Yep. Wait, you have a dad joke.
Dad joke time? Okay. You ready?
Yes.
Here you go. How many tickles does it take to make an octopus laugh?
8.
No, 10 tickles.
I like it.
Good one.
Yep. Okay. I think that's all. That's all, folks.
That's all, folks. Make sure to like and subscribe, share with your friends, leave us a 5-star review,
Yay.
all that good stuff.
Yes.
All right. Thanks for listening. Bye-bye.
Bye-bye now.